on speed.
All right, Britton, thank you. Hey, our Ask the Doctor segment today, we are talking about weight loss surgeries. And Dr. Amit Taggar is a bariatric surgeon at St. Vincent's East and St. Vincent St. Clair. Good to see you, sir.
Nice to be here.
When you use the terms bariatric surgery, what are you talking about specifically?
So it's the manipulations of your organs in your abdomen in order to create not just weight loss, but resolution and improvement of comorbidities such as hypertension, diabetes, and hyperlipidemia, among other comorbidities that
So
patients have.
you are, after these surgeries, you are expected to lose weight, which will in turn lower blood pressures and those type of things.
To a certain extent, the surgery works a lot on hormones, and actually 80% of patients that leave the hospital that are diabetic are off their diabetic medication after just the surgery itself. So
pretty amazing.
Yeah, it's a lot of great improvements of patients' health that we're really
All right,
involved
Dr.
with.
Taggar, we have a caller on the line, and Debbie is in Alabaster. Debbie?
Yes.
Hey, go ahead.
Hey, how are y'all guys?
Good.
My question is, I had weight loss surgery in '06. I had gastric bypass. Did wonderful, no complications, and lost 110 pounds. Did wonderful. Come off all my medicines at that point, and of course, I had a lot of problems that were hereditary. So, slowly went back on medicines that I need, that they changed them from what I was on before. At that point, which was about a year down the road, they started slowly putting me back on my medicines. So some of the medicines that they put me on down the road, I started gaining my weight back and couldn't understand why. So I started researching all these medicines and found out that the side effect of like 4 of my medicines was weight loss. It was weight gain.
Are you on all those medicines now still?
Well, no. Okay. When I found out, I had already gained back about 55 pounds, and I was in tears.
Aww. So
I went to my regular doctor, and he, helped me get off of those. But now I've gained, my total weight gain back was 65 pounds. What I want to know now is, because I didn't lose all that I wanted to in the very first beginning, what is my option now to get, to lose the weight? You can't have another weight loss surgery, right?
Well, it's a good question. A lot of patients have what we call weight recidivism. First off, weight recidivism does happen. In our study with gastric bypass, we've shown that 60% of patients have, at 10 years, the excess weight loss is about 60%. But weight regain does happen for a small subset of patients, and for your instance, it was due to medication. There are options. There's options of one, I think the most important thing is bariatric surgery. As being a surgeon myself, my patients are my patients for life. So when this happens, it's really important to meet with your bariatric surgeon or myself and go over the options. One option is medical weight management, and do this again for about 3 months. Is revision an option? Yes. Where I came from, we actually did more revisions than any other place in the world. So revision is an option, but to have revision, you first have to sit down with me and talk to me about exactly what's going on, really make sure your diet, exercise, and things are optimal, and then we can go forward.
So not just your medical doctor, you should be working with a bariatric
Absolutely.
doctor.
For the rest of your life, you should be seeing a bariatric surgeon on a regular basis, because it's a surgery that you have to be seeing for the rest of your life to be successful long term.
Right.
Okay.
Well, my doctor moved.
Okay. Well, if you want,
if
you would like to, go ahead and get contact with my office, and we'll be more than happy to see you.
All right.
Okay.
Good luck, dear. Thank you. Let's go to Yolanda. She is in Centerpoint. Yolanda, hello.
Hi.
Hi. What's your question?
My question: I have had Crohn's for 14 years, and I do battle obesity as well. Am I a good candidate for weight loss surgery?
Well, now that there's different options, Crohn's disease is a problem really of your small bowel, as well as can be your stomach and colon. There are options right now. There have been studies that have shown for people who have Crohn's disease, ulcerative colitis, and other inflammatory bowel disease of weight loss surgery, and you are a candidate of weight loss surgery. The type of weight loss surgery might change depending on how bad your symptoms are, what medications you are, and so be it. But once again, to say you're not a candidate for bariatric surgery is not appropriate, because you are a candidate for bariatric surgery. It really depends on what the optimal surgery for you is.
So you would have to have, just for anyone watching thinking about it, if you feel like you want to look into this, you have to do certain things. You won't just do surgery on anyone, right?
Absolutely,
you have to make sure everything else is okay.
Absolutely. Before you go to the operative room, at any time, we make sure you're optimal on your medical health. And that could be things that are just routine health maintenances that have nothing to do with bariatric surgery, to needing upper endoscopies and other type of, seeing your cardiologist, pulmonologist. So you definitely will not have surgery unless you are at your optimal medical peak.
All right, Dr. Amit Taggar at St. Vincent's East and St. Vincent's St. Clair. Sorry, our questions are a little long and lengthy, so we only got a couple in, but thank you very much.
Thank you for having me. I appreciate it.
All right, now let's go to JJ.